87 of them are under investigation. That takes us to 1,301 active cases, with 1,297 of them being local. In terms of age brackets, 205 are aged between 0 and 9 years of age, 213 are aged between 10 and 19, 316 are in their 20s, and 224 are in their 30s. There are 76 people in hospital, 23 in ICU and 14 on a ventilator. None of the people that are in hospital are fully vaccinated. In terms of vaccines, there were 35,464 vaccines administered in state-run clinics yesterday. That's our second biggest day on record. There's been 2,553,178 doses administered in total through state-run centres, and we're now almost 2/3 of the way through our 1 million target in 5 weeks. We've got 373,576 doses to go, and on the current trajectory we'll get there a little bit early, so that's good news. In terms of testing, there were 49,548 tests administered yesterday. 86% of them were turned around within 24 hours and 98% within a day. It is great to see thousands of Victorians out there yesterday getting tested to protect themselves and their families. We had to temporarily stop testing at 7 sites yesterday, including the showgrounds, but they will resume as normal today. And there are new sites in place in the northern suburbs. So if you live in Moreland or in Hume, you can visit the Brunswick Town Hall, the Harry Atkins Centre in Coburg, and Craigieburn Central. And 3 sites which are usually closed on weekends are open today and tomorrow, including CoHealth, Collingwood, Fort, Inner Melbourne. In terms of business support, today I'm able to announce support of up to $2.34 billion over a 4-week period to take us through to the end of September. That will provide support for 175,000 businesses that are affected by the lockdown extension. We welcome the continuation of the 50% support from the Commonwealth. Treasurer Pallas spoke with Treasurer Frydenberg last night and this morning, and we are grateful for that ongoing support. Victorian Government business support programs have delivered more than $3 billion into the bank accounts of businesses since the May-June lockdown, and our support overall through the duration of this pandemic is now in excess of $10 billion. To go through those packages of support, the Licensed Hospitality Venue Fund will continue as it has been going. That's an additional $289 million to continue to provide support of $5,000, $10,000 and $20,000 per week to licensed hospitality venues based on their capacity. The Small Business COVID Hardship Fund is having $448 million added to it to take the total of that fund to $700 million. So the grant amount under that fund will increase from $14,000 to $20,000, and the number of businesses to be supported by that fund will increase from 18,000 businesses to 35,000 businesses. In regards to the Alpine support top-up, there will be another fortnight of payment for the Alpine support program, another $11.2 million. Payments of between $10,000 and $40,000 to take those businesses through to roughly the end of the ski season. And in regard to the Business Cost Assistance Program, which supports some 132,000 businesses, that will continue at the rate of $2,800 per week, with a couple of important exceptions. For those businesses with payroll of between $650,000 and $3 million per annum, they will instead receive a weekly payment of $5,600 over the next 4 weeks. And for those businesses with payroll between $3 million and $10 million, they will receive $8,400 per week. Those payments will be made fortnightly rather than weekly over the next 4-week period. And I should just say for BCAP recipients, because we now need to tier those businesses into those 3 tiers, that will take a week or so for us to do that. But when a payment is received, it will be a fortnight's pay rather than a single week's payment. So $2.34 billion of support to get us through the next 4 weeks, and obviously if it needs to be extended beyond that, we will have more to announce later in the month. But that level of certainty that we're providing to business over the next 4 weeks with $2.34 billion of support co-funded by the Commonwealth, I think that certainty will be welcomed by business, and we're certainly very thankful to the Commonwealth for their 50% contribution. With those comments, I'll hand over to Brett, and then we'll take your questions.
Thanks, Minister, and good afternoon. So on vaccination, yesterday was our second biggest day ever in the State Commission services, with 35,464 vaccines administered. There were an additional 47,000 bookings made yesterday. 25,000 AstraZeneca bookings are still available over the next 7 days, so please get in now and take those up. We've got community-led and culturally appropriate vaccination pop-ups being stood up across Melbourne. This weekend there'll be vaccinations at the Hindu temple, the BAPS Sri Swaminarayan Mandir Temple in Mill Park. That's a partnership between the Department of Health and the temple. Translators and medical staff from the community will be on site over 4 days to provide support in Hindi and Gujarati languages. These programs are proving to be incredibly successful with several multicultural communities. We ran one last weekend in Thornbury with the Greek community at their local Orthodox church. We've had similar vaccination sites for the Jewish community and the Samoan community, and it builds on great work emerging in the western suburbs, especially led by Dr. Mukesh Haikawal and others. In terms of our current cases and the geography, 96 are in the northern suburbs. That includes 54 in Hume, really the biggest LGA involved at the moment, and 18 in Moreland. 55 in the western suburbs, including 17 in Wyndham, 14 in the southeast suburbs, 11 in the inner south, including Stonington, 6 in the city of Melbourne, 3 in the eastern suburbs, 1 on the Mornington Peninsula, and 4 in Shepparton. With regard to current outbreaks, the Acquire call centre, there are now 25 cases. The source of acquisition is still under investigation. There are 700 close contacts identified. The Box Hill construction site, there are more than 58 cases associated with this outbreak, up from 20 yesterday. All sites are closed. 158 Tier 1 primary close contacts have been contacted. The Japara Bayview Aged Care in Carrum Downs, there's been one case, was vaccinated. 62% of the staff there are fully vaccinated. 82% have at least one vaccine. There's in-reach testing being done there today, and there's a local GP to vaccinate additional residents and staff in coming days. Kassar Suites in Coolaroo, one case notified on the 1st of September, now already 37 cases. Located within a busy shopping strip near T-Bus restaurant and Hassoon Cafe. And then of course there's the base backpackers. One staff case from Acquire resides there in St Kilda. All resident staff and visitors are delegated or designated as primary close contacts. The case has been transferred. The partner and several at-risk close contacts are in formal hotel quarantine. There are approximately 70 residents, and alternative accommodation is being arranged for them. And then lastly, the Hume Valley School, a special needs school in Dallas, now 5 cases with 2 students, 1 staff member and 3 additional household contacts. Just a reminder for supermarkets in terms of COVID-safe practices, Supermarkets and shops are absolutely essential. Everyone will go there at one point in time. They're not inherently high risk, but they are high volume for our contacts. They have a lot of human movement through there. That means many thousands of Victorians will shop alongside those who are not yet diagnosed with COVID-19. So a reminder that it's one member for each household once a day. Think about minimising your exposure, keeping your distance. Don't be caught up in an exposure site. If you can click and collect for your shopping, please do so. Go less frequently. Check in with the COVID-safe QR code. Wear a mask and keep your distance, including when reaching over someone to get something on the shelf. Just take your time to keep that distance. We've worked closely with supermarkets, as have Department of Jobs, precincts and regions. They're extremely cooperative and helpful. They absolutely want the best for their staff, understanding the risk, customers and all Victorians, and I'd like to thank them for all of their cooperation. And really lastly, a plea to all Victorians of any background that there are supports available. We can help you as you require it. We're continuing to see reluctance to come for testing until it's too late. That's not to place blame, that's to recognise that there are challenges for individuals, there are concerns about coming forward for testing. But by getting tested, because testing doesn't make you positive, getting infected is what makes you positive. Getting tested is what allows you to protect your family, to get early treatment as required, and to make sure that this doesn't spread any further than it needs to. If you're concerned about losing money, support's available. Go to www.coronavirus.vic.gov.au, click financial support on the homepage. There's the COVID-19 disaster payment if you can't work because of restrictions in place. There's the $450 test isolation payment if you can't work while you're awaiting your test result. And of course there's the $1,500 isolation payment if you have to quarantine for a 14-day period as a close contact. That's it from me. I'll pass back to the Minister.
Fair to say public health questions probably to Brett, but anything else?
Just on the 7 testing sites that needed to be closed yesterday or suspended, why was that at the Western Showroom?
I don't have an update on that, sorry.
I'm sorry, I don't have that information, but we'll get that for you.
Do we have an update on the big Pfizer announcement that was made by the Prime Minister yesterday? Do you know when the Victorian allocation will be factored into our booking? When will those be reflected in the system?
So we know that there's additional Pfizer coming. That's absolutely welcome. I understand that there's an allocation on a per capita basis, as there's been for additional Pfizer by and large. So we welcome the 25% odd that will come to Victoria. There's usually a 60-40 split between primary care or general practices allocation and state hubs, but it's all welcome. Don't have the dates. That's really to be determined by the Commonwealth on the basis of receipt of that additional dose from the UK. But of course, we welcome it. We wanted to accelerate our vaccination uptake as much as possible. I would remind every Victorian there's AstraZeneca available in terms of supply. There are AstraZeneca places available in our state hubs, and there are GP appointments that can still be made, of course, for AstraZeneca and for Pfizer. So people should really bear that in mind, come forward for AstraZeneca, especially those over 60, where AstraZeneca is the only vaccine available currently for them, and may be the only vaccine available for some weeks or months to come. Do not wait for other vaccines. People have concerns because they've got pre-existing illness. They say, I've got respiratory illness, I've had a deep vein thrombosis, I've had high cholesterol or high blood pressure. Those are the very conditions that mean that they should be coming forward now for AstraZeneca vaccine and not waiting. The vaccination is not more risky if you've had chronic conditions. COVID is much more risky if you've had chronic conditions. It is more of a reason to come forward and get your vaccine now, not less of a reason.
Did you read much into the fact that case numbers have gone down slightly on yesterday? Obviously one day is not a trend, but does that signal anything?
No, I don't think it does. One day is not a trend. the trend over 7-day periods has been incrementally increasing. I expect that to happen until we can get much higher vaccination coverage. Of course, there are some settings where control of transmission is occurring, and so we get on top of those outbreaks that have had an early explosion of cases, and therefore you see the numbers fluctuate day to day. But of course, the overall trend is a slow and steady increase. That's why vaccination is so critical, and following the rules, because we know that makes a big difference, and that includes those work sites, absolutely includes transmission between households, and indeed at those exposure sites which I've called out today, and shopping centres, those other high volume areas where you can make a difference by not transmitting to someone else, by protecting yourself when you're potentially exposed.
Has there been any new transmission at supermarkets or shopping centres, considering you're calling it out today, or is it just the fact that there's so many that are exposed?
We've certainly had transmission historically. We know that transmission has sometimes occurred with very little contact. We've had CCTV that's just shown transmission between people going through the same checkout within a couple of minutes. That doesn't mean that's how all transmission might occur. It doesn't make it high risk necessarily, but with literally hundreds of thousands, millions of people going through those supermarket settings every single day, we do need to say, look, make sure that you're COVID safe as much as you can be.
The Box Hill cluster going from 20 to 58 in a day, that's a marked increase. How do you categorise that increase, and what does that say about the safety of that workplace?
Look, it's absolutely an indication of COVID-19 and this virus, and transmission occurring so readily. And when you're in, whether it's in an essential workplace or whether it's in any other gathering where a number of people can be exposed, especially indoors and especially in those work settings where you're there for a number of hours, the potential transmission to dozens and dozens of people is always there. Sometimes the very substantial increase in numbers that we see over the course of a day is because we're suddenly doing the testing blitz of all of those close contacts. A number of those may not have been symptomatic, and we're just turning them up. That said, there might be some people who are minimally symptomatic and haven't come forward for testing. That's why the reminder every single day we've been here has been that those first, sometimes very mild symptoms, runny nose, sore throat, mild cough, headache, please come forward for testing. You might be the first person in the workplace that picks it up. That means that there are only 2 or 3 other close contacts who end up being positive rather than 50 or 100. It is so easy to have 100 people. Our childcare centre, My Centre Childcare, has more than 100 associated cases now. So easy to spread very substantially.
Does it indicate that it was a COVID-safe workplace if that sort of spread is happening? And I'm thinking it's an outdoor work site.
I don't know that it is an outdoor work site. Look, I think COVID-safe practices are something you need to be mindful of all of the time in all workplaces. Nobody does it perfectly, or sometimes they're doing a great job on most days, and then again the guard is dropped on a particular day. Even in a very COVID-safe workplace, you can absolutely have transmission. The risks are there, and sometimes it relates to those engineering elements of ventilation. So an indoor space where people are in close contact for hours and hours needs to have you wearing a mask, needs to have you testing if you're symptomatic, needs to have the ventilation maximised, and if that's opening windows and doors, then that should be done as well.
Would it make you more cautious to ease those restrictions for construction on September 23?
Oh, look, the caveat for construction opening up is absolutely the high vaccination coverage. We want that. That'll be a genuine risk mitigation. But those other practices need to be in place as well. The mask wearing needs to be there, the social distancing, the checking in and the testing. But as we've seen, construction sites are not immune to transmission, and wherever people come together in relatively large numbers, the potential for accelerated transmission is there.
Well, given the contagious nature of Delta, will we be wrong not to shut down construction completely when we were trying to hard lock down everything?
We are trying to move by increments to opening up in a safe way. We'll review right through this month, as we've always done, what is reasonable and proportionate to do so. We know that people are more than fed up. They are absolutely frustrated and challenged by the lockdown that's gone for weeks and weeks. But we can move by increments, but we have to move those lower risk elements first, and we'll consider where transmission's occurring, we'll consider what mitigations can come in order to do that, but we want to move slowly by increments. We don't want to take steps backwards.
I understand moving forward, but when we did make that decision to hard lockdown to try and get it back down to zero, should we have considered shutting construction?
We were seeing primarily transmission driven by social networks and by some other essential sites. So I don't think that would have made a difference. We were seeing that emergence of mystery cases, and really that's the danger sign that getting back to zero is profoundly challenging, and I think we've seen that here. I think that's the challenge that New Zealand and ACT will face. We absolutely threw everything at it, as you know, and the reason why you aim for zero, or you aim for long-term sustainable low numbers, no people infectious in the community, is for that reason of being able to open up again. Nobody wants to be in this situation that we're in now and faced with a slow but steady increase in the hundreds. That's why you do absolutely everything to get back down to sustainable numbers if you can. When you're faced with a situation we're faced with, we're going to keep a cap on it to the fullest extent that we can, but we know that there's a long haul to go, and we need to move slowly and surely to be able to have some of those freedoms and move towards a more normal existence.
With that checkout example you gave, is there an indication of, or was that airborne for a couple of minutes? Was it a surface? And do you know what supermarket it was?
Oh, so that related way back to the Epping cluster. It was almost certainly airborne transmission. There's no indication that surfaces would have been the contamination there. And as we've said many times, airborne transmission's a risk.
People wearing masks.
People were wearing masks, but it still happens. And you know, we've all seen masks not worn properly. A mask on a chin does bugger all. A mask that's below the nose is not working. We all breathe through our noses. So if you're wearing your mask over your mouth and below your nose, but breathing through your nose, that's an issue. You will transmit to others if you're COVID positive. So we can all do better, but you know, this is an invisible virus. We don't feel the risk and the threat with someone standing next to us necessarily, because we can't see that they're unwell, and they may not be unwell. We just need to work on the assumption that we're at risk when we're in proximity to people, when we've got that interaction.
Professor, we've seen some pretty high-profile influencers flouting the rules on social media and so forth. What's your message to people that are still, you know, flouting the rules and that incident in particular?
Oh, I'm not going to comment on the incident in particular. We're all fed up. We're all fed up with being stuck at home, not being able to see friends and family. My message to anyone, social influencer or otherwise, it's the message to all Victorians. There is really only one way to protect yourself, and that's following the rules. There's no question that it's hard. The alternative is too awful to contemplate. Tens of thousands of cases could be our reality if we don't maintain, you know, those really tricky constraints on our life. That's just the awful dilemma that we've had right through. We've held a tsunami of cases back for 20 months. It's come to us in waves. We've beaten it back in waves. We've got maybe the biggest challenge that we've ever faced, but we've also got a proper pathway out of here with vaccination. So hold the line in these last weeks and months until we get the high vaccination coverage that means that we can have greater confidence about seeing people, you know, initially outdoors, initially in those ventilated settings and in smaller numbers, but we will get there.
So the Saturday paper said this morning that hospitalisations in the ICU ward in Victoria is perhaps worse than what has been announced. They said 91% of rooms are occupied. Royal Melbourne Hospital went to pandemic mode on Thursday. Are you concerned that with cases rising that the health system might not be able to keep up with this?
Look, I think there's a huge amount of preparedness work that's been done, and we bring online ICU beds as required, and we're planning on the basis of what the projections are. And so the ICU capacity is readied for an increase and mobilisation of those ICU beds as required. The bed availability is actually very substantial. What you need to do is activate them and have the staffing available, and that is in the pipeline, and we are ready as an overall health system to be able to do that. What I can tell you is that, you know, we've been planning for months and months. As of the 2nd of September, we've got 429 open ICU beds. We've accelerated new projects. There are recommissioned former sites you'd be aware of, and there's been the billions of dollars invested in PPE to keep healthcare workers safe. There is a new pandemic ward opening this week at the Northern Hospital. That's a ward with 28 beds, all with negative pressure control, so can manage each and every COVID positive patient. And through a staged approach, we can bring online the capacity up to 1,500 ICU beds. Of course, there'll be staffing challenges, but the principle of all of us getting vaccinated reduces the risk of transmission within hospital settings. Clearly, our healthcare workers have been vaccinated at very high rates, and there are a huge number who are fully vaccinated, but the risk of transmission to an emergency department, to a ward, to an outpatient setting exists, especially when we're not vaccinated. So we've got a role to play as a community as well, and it means not furloughing dozens of staff who are then unavailable to do ward work, ICU work, emergency work.
So that 91% is just what's currently available. More will be opening up in the coming weeks. Do you
That's
have an
right.
idea on that specific number?
I don't. I'm not the state controller for the hospital system, but we can provide some details about what might be in the pipeline.
Professor, considering that we know that cases are going up, and I know the Premier touched on burnout modelling yesterday, where are we going? Where do you think that this will peak? Do we have an idea of when we think case numbers will peak? And what type of daily case numbers are we looking at for, say, that September 23 date that we're looking forward to at the moment?
We can't say for sure when case numbers will peak. We hope that the peak is as early as possible. In part, it does depend on maximising the vaccinations available. We know there have been constraints up to this point in time in terms of supply, but with additional Pfizer being available and with the allocations of AstraZeneca that could be mobilised tomorrow, we've got an opportunity to bring that peak down and to bring to make as early as possible that peak, so that we're going into October, November with decreasing numbers and not increasing numbers. There are a lot of variables here, but vaccination coverage is the one thing that we know will limit how high that peak can get. What the burnout modelling told us was that without the restrictions that we've got in place now, we would have seen a 30% day-on-day increase in numbers. Today would have been 3,000 or 4,000. By the end of next week, it would have been 10,000. So really substantial increases without restrictions, but even worse without the high vaccination coverage.
Obviously, there are lots of variables. It's very hard to predict. I think a lot of people are a bit concerned now that we're on the same trajectory as Sydney, and we're maybe 3 or 4 weeks behind Sydney. Could we be that? Is that a scenario?
There's every possibility that we're following a slow and steady increase in the way that New South Wales has. We've got the option of being 1 week behind Sydney or 6 weeks behind Sydney. That does depend on doing the right thing. It does depend on the vaccination coverage. And I'm hoping, and I think it's entirely possible, that we can plateau, because we've got, at a relative point in time with the case numbers, we've got a real opportunity to get to the higher vaccination coverage level with a relatively lower caseload in Victoria. That is our opportunity. We have to grab it with both hands.
Our number, is it 2? Is it almost 2? And how concerning is that?
It's hard to say. If you're just following the last few days, it's closer to 2 than 1. Over a longer period of time, you get a more stable read on it, and we've had up and down. Today's a down day.
What is it today then?
I don't know today, and sometimes it's not appropriate to calculate just over a 3-day period. If you look at the longer term, we're seeing a 30 to 40% increase with each generation of transmission. That's too much. That's too much. Anything's too much. Any R value above 1 is an increase in numbers. But we'll see over a longer period of time where it stabilises. I expect that we've got an opportunity to drive down. We know, we've identified again those higher risk settings and the areas where we need to focus on geographically in terms of communities. So there's always an opportunity to drive down as you see risks emerge.
Just on schools and ventilation, what needs to happen with ventilation in schools before they can open up safer?
Yeah, as you've heard and seen the announcements, there is absolutely work going on to do the ventilation assessments in schools, which is really to see how well they are ventilated by virtue of their construction. The old schools, the newer schools, metro and regional, multi-storey, single-storey, that work's been done across all of those types of schools. The CO2 monitors basically tell you what the real world effect is of having a number of people in a room, and the build-up of carbon dioxide is really a marker for the potential build-up of virus should there be a number of kids and teachers in a room, and what the effect of increasing ventilation would do to that carbon dioxide level and therefore to the risk of viral load. So the CO2 will then give us a pointer to the changes that need to be made in specific rooms and specific schools. Will tell us in general terms what schools are at greater risk and where we might need to put those ventilation HEPA filters to reduce that risk. And they'll go in areas where the ventilation is poorest, where the risk of transmission is therefore highest. And all of that work needs to be done. Masks will be a consideration obviously for kids in schools. And all of those other elements that might mitigate that have been used around the world. That may include rapid testing as well. So all in play, and really what we've learned is we need that full combination of elements to be able to manage the risk to kids.
How feasible is rapid testing to you?
Sorry?
How feasible is rapid testing to you?
Well, there are some dependencies. We need TGA approval would help for home testing. At the moment, it needs to be healthcare monitored testing. That puts a constraint on how many kids you could get tested before turning up at school. But the UK's done it in hundreds of thousands of kids. If you can do it as a home test, if you can do it on a regular basis, then they're cheaper tests than the PCR tests. So with that TGA approval, with a substantial rollout of tests, with a feasible and acceptable swab for kids, and there are various types. There are shorter swabs that are more comfortable. There are swabs that sit in the nose rather than tickle the brain, that may well be more comfortable for kids.
That's your preference with TGA approval?
Whatever works in terms of having the sensitivity and specificity, so the accuracy that we know tests need to have. They won't be perfect, but what works out as a real-world feasible test for kids, if they're happy to line up for it, I'm very happy for them to be used.
New South Wales is sometimes tripling our daily testing numbers. Could and should we do more here in Victoria?
Oh, I'd always encourage everyone to come forward for testing. I saw a substantial car queue on the way in. I think people are responding. We don't want a 3-day turnaround time that has been a reality in some jurisdictions with very, very substantial demands, but we've got a lot more capacity in our testing system. So I would absolutely encourage people, do not feel like you can't get a result within 24 hours. You absolutely will. More than 99% return the next working day. So that is not a constraint on the system. Absolutely, I'd encourage people to come forward.
So we should have more. We've got the capacity.
We've got the capacity. We've not got the blowout in waiting times in those drive-through clinics. So people should move through.
Back to schools for a minute. Xavier College sent out a letter saying that they wanted all teachers getting their first dose of vaccine by term 4. Are you expecting to see more of that across schools across the state?
Absolutely. Obviously there's the Blitz, September 7 to 17. That's for Year 12 kids in particular, but we want teachers to be part of that. We want other potentially at-risk contractors and those attending school to be part of that mix as well. So I don't think teachers need encouragement. They understand the risk to them, and we understand what it means for them to be vaccinated to protect other teachers, to protect the kids.
Do you think there'll be a pushback from teachers not wanting to get the vaccine?
Oh, no more than exists in small numbers in the general population. There are always those who've got questions. I welcome people to come forward with questions to speak to their GP or other specialist. The hardcore anti-vaxxers are in tiny numbers. I'm not worried about them. I am worried about people who've got questions who aren't seeking to have them resolved. They might say, oh, this is a relatively new vaccine, so is safety really assured? The answer is yes. They might say, I've got these chronic conditions, maybe I shouldn't be getting vaccinated. The answers to those are relatively simple. you are so much more at risk of COVID-19. And if we're getting to 1,000 cases a day, that risk becomes extremely real for people, but you need the full vaccination coverage. Do not wait until we're at 1,000 cases a day to get your first vaccine, because you've then got 6 weeks to be fully vaccinated and another 2 weeks for the immune response to kick in fully. So do not delay. But those are conversations for your GP to have with you, and speak to other family members who've been vaccinated who can tell you about their experience. They're really important conversations.
Back on essential workplaces, is there anything that's being done or could more be done for proactively reaching out in especially hotspot areas to essential workers, especially younger people in their 20s and 30s who are working in supermarkets and things like that? We know that younger people have had a long time before they become eligible for vaccinations. Could more be done for proactive kind of outreach?
Oh, there is so much outreach being done. Look, a lot of it's on Zoom. Different modes reach different population cohorts in different ways, but there are also community engagement workers, there are community leaders, there are religious and sporting organisations. We've engaged with all of them, and we've especially focused on those hotspot areas. So there's been no lack of effort in that regard. What I would say for young people is Pfizer's available for 16 and above now, and so again, don't delay. There'll be tightness in the Pfizer bookings, but AstraZeneca is also available for those who want to make that consideration on a case-by-case basis.
Consideration to let pet groomers operate. Vets are warning that it's leading to an animal welfare crisis.
Yeah, look, there has. It's been worked through with the team who work on the approved worker list. That's under consideration and potentially in play.
You might be aware of a report out of the UK that recommends that healthy children aged 12 to 15 do not get a COVID jab because of a rare risk of a heart complication, saying that the risk of the vaccinations, the benefit of the vaccination is slightly better than the risk of getting the virus. Should parents be concerned about research and advice like that?
Look, we will take advice from the TGA and ATAGI on the basis of their assessments. What we do know is that different regulatory agencies have slightly different views on these vaccines depending on the caseload within a country, depending on all of the considerations that they make. What I would say about the UK determination on this vaccine is they've really not taken into consideration long COVID in kids. That's a not insubstantial burden. We know that kids don't get the severe disease at high rates at all. The vast majority of children get mild disease, asymptomatic disease. I'm not concerned about kids getting severe disease in high numbers or going to ICU in high numbers. But the burden of long COVID in kids is not insubstantial. It might be 5 or 10%. For hospitalised kids, it might get to 15 or more percent. But long COVID is cognitive decline, fatigue, respiratory symptoms. That is a consideration that ATAGI and the TGA should have in mind as well as you're balancing the risks and benefits. And at a population level, the considerations of what it means to get that fuller vaccination coverage by including 12 to 15-year-olds. That's not my call, and I wouldn't pretend to be advising ATAGI. They'll advise us, and we'll accept that.
Minister, it says here in your statement the statewide lockdown's been confirmed until 70% of Victorians have had at least one dose. Does that mean regional Victoria is not coming out of the
Sorry,
lockdown?
can you just speak up? I can't hear you very well.
It says in your statement the statewide lockdown has been confirmed until September 23. Does that mean that regional Victoria won't be coming out?
No, it doesn't mean that at all. What we've said in regards to the Premier's already indicated that we'll look at the issue in regards to regional Victoria over the next week. Nothing's changed in that regard. If the statement says that, it might be slightly inaccurate. In regards to payments for those businesses in regional Victoria, they'll get their first fortnight, and if they come out of lockdown earlier than that fortnight, if they're out after a week, they'll keep the second week of payment.
There's no idea when trials will begin.
I should probably take this off.
So there's no ideas on when trials maybe begin for regional Victorians in going to events and when things might...
You're talking about the double vax?
Yeah.
Look, that's something. They're conversations that we're having with industry, with organisers. I think those conversations will happen over the next few weeks, but it's not. There's not a a concrete date about when that'll be in place. But we will certainly, we think that in terms of a trial for those sorts of small gatherings, which might be done in a double vaxxed only environment, we think it makes sense for that to start in regional Victoria.
Minister, just in relation to the incident I spoke to the Professor about on social media, just how frustrating is it for you to see such high-profile people, flouting the rules?
Oh, look, it's not good that anyone flouts the rules. It makes it more dangerous for the entire community, and it makes it more likely that these sorts of restrictions will be in place for longer. Obviously, when it's someone with profile, it's in some respects it's more publicised, and it makes it clearer that sort of conduct's not acceptable. So, look, I'm not going to individualise this. That incident's been very, very well viewed now, very extensively viewed. I'm sure the participants are, well, they should be appropriately embarrassed, but it serves as a warning to all of us that, the more of that sort of occurrence takes place, the harder it is for us to drive case numbers down.
Will they be punished?
Well, that will be a matter for Victoria Police and our health authorised officers. I understand they've been talking to one another. That's not a matter for politicians.
So on the trials that may take place in regional Victoria for those who are double vaccinated,
yeah.
Will to show you that you're double vaccinated, will it be some kind of federal kind of certificate of your fully vaccination status? Or will it be a Victorian specific one?
Well, that's part of the work that's going on. So right now I have effectively my vaccination passport in my Apple Wallet, and it's come through the Medicare MyGov hub. There's work going on about how that can be integrated into our own Services Victoria app. There's work happening at the Commonwealth level. I think in an ideal world, and this will take a while, you get to a point where your vaccination status is something that you scan rather than just something that you show. That's already the case in some parts of Europe. I know that's the case in France. But that's going to take a bit of time. You need to integrate that nationally into those platforms. But there may well be, in a smaller scale setting, some opportunities before you get to that technology point.
I don't know if you can talk about the Premier, touched on a home quarantine trial in Victoria. Can you explain why does Victoria need to do a home trial when South Australia has been doing one on behalf of National Cabinet anyway?
Well, look, I think every state's circumstances are different. We're talking about the potential of bringing people back from an environment where there is a large amount of COVID into a state where we've also got some significant cases. So I think the way that those trials would work in those circumstances wouldn't necessarily be the same. There may also be other types of approaches that we would take that might not have necessarily been used in South Australia. So I think, trialling these sorts of things in our own environment with our own rules in place, I think is important, because ultimately it's going to be Victoria that needs to live with the way that trial and what potentially comes from it is conducted.
Could there be home quarantine for international travellers into Victoria before Christmas? I know there's a lot of play, but
I would imagine that that's unlikely. I mean, if the question is could, there's lots of things that could happen, but that wouldn't be consistent with the current national rollout. But I don't think I'm in the business here of ruling things in or out, but I would think that international travellers in home this side of Christmas would strike me as unlikely.
Do you know how many of the 190 were active in the community while infectious?
No.
Still not knowing it?
No, don't have that number.
I also have one last one for the show. I'm just going back in time a few weeks to August 4, when you posted that photo of Dean Boxall. 0 cases, and then it all changed a few hours later, and then we had a couple of outbreaks. And we were assured early on that you had your arms around them and you were very confident that they were contained. In the bigger picture now, where do you think we lost control of it?
It may well have been another incursion. We are joined at the hip with New South Wales. There are 56 border crossings on land. There were several thousand red zone returnees. There are essential workers who come in there hundreds and thousands every day. With a significant caseload in New South Wales that was increasing over time, the risk of incursion was always there. Clearly that's how it started. We drove cases down to zero, we linked each and every one of them. I think we had control of that outbreak. It may well have been that there were other incursions into the community that emerged without that early recognition of testing, without the first linked case coming to our awareness. When you've got just a few generations of transmission that's already occurred before you find out, and this is New Zealand's challenge at the moment, then you can have hundreds of cases before you know it, within a matter of a couple of weeks. So I think we got our arms around that earlier outbreak. We still bought ourselves another few weeks to vaccinate. This has always been the real benefit of crushing each and every challenge that we've had. We are trying to buy the space to get to that high vaccination coverage before we've got thousands and thousands of cases a day. If we had Delta last year and it got away from us, we would have dealt with restrictions and thousands of cases and a challenged health system for months and months and months. So those efforts are really, really difficult, and those sacrifices are really substantial. But the benefits that you get each and every time that you can drive down to zero, as we did for that earlier outbreak in July, are enormous, even as you get that next challenge. And you know, we're in a place now where we're still doing our utmost, but we're being realistic about what the prospects are for zero.
So are we at a stage now where we just don't know how many of the cases were in the community while infectious? Is that something that the contact tracers just aren't able to stay on top of at the moment?
No, it's not. It's not that they're unable to stay on top of it. It's that in the reporting period, when you've got 200 cases in a day, with 100 of those coming in afternoon to midnight, we're not going to resolve the status of them for 8 o'clock or 10 o'clock reporting on Twitter or for these presses.
Professor, are you confident that the regions will be reopened this week, and if so, any added measures being taken to ensure the virus doesn't seep into the region from?
Look, the regions are on track for some level of easing. We are always alert, as should the regions be, to the risk that's coming through. That will remain. So I hope no one drops their guard in the regions. I know they fiercely protect their COVID-free status that many of them have had for a long time. In terms of managing the risk out of metropolitan Melbourne into regional Victoria, that will be managed in the public health directions as well, in terms of the limitations on movement for Melburnians. But it'll also be around the constraints on essential workers' movements and the like. So that's part of it, but a big part of it is everything regional Victorians can do to check who's coming for their food and services and visitors, and to make sure that they're other regional Victorians.
Would you reconsider a ring of steel again?
Look, the ring of steel terminology has probably been overused. We've got a different descriptor, which is probably more appropriate. It's a mobile, agile monitoring and surveillance program with VicPol that really looks at different roads and different routes out, and is probably significantly more effective. So rather than having these fixed points on the road that lead to delays, and that those who are really highly motivated to get around will just get around on back roads, it could pick up anyone at any time on any road, and I think that means we get better compliance that way. So in that sense, the ring of steel is as strong as it's ever been with that kind of approach from VicPol.
There's been a renewed push for rapid antigen testing. What are discussions with that at the moment?
Oh, we've always had an open mind about rapid antigen testing. The reason why it's not part and parcel of us as community members getting tested every day is that the PCR test is the gold standard. It turns around a result in 24 hours. In certain circumstances where you can do a relatively inexpensive test with a relatively quick result and take actions accordingly, even if you don't pick up every case, but you pick up those that are likely to be infectious, we will continue to explore the settings in which that's most appropriate, where PCR testing can't do that job. But as I said, we've got some constraints on home testing or on testing that isn't under a healthcare worker supervised framework. But if we can do it under a pilot, or if the TGA comes to a determination that home testing kits with rapid antigen tests are authorised, then we'll crack on with it.
Confirm if that double vaccinated case in aged care that you mentioned earlier, the Japara one, can you confirm, was that in a staff member or a resident?
I understood it was a staff member.
A staff member, okay. And then you also mentioned that aged care facility double vaccination was in the 60%, 68%?
Yep.
Does that concern you that we're only at 68% for double vaccination for aged care facilities, considering what we went through last year?
Yeah, look, I would like to see it at a much higher rate. The Commonwealth has responsibility for private sector aged care staff vaccination. We'll support it in whatever way we can, and we've obviously opened up our hubs at different times for all aged care staff, and we've really pushed for them to get vaccinated. We're moving to mandating vaccination for aged care staff as well. But for anyone who's holding out for that mandate to come through, when they can get protection now for themselves, but as has been illustrated, for the residents that they've got care responsibilities for, they should absolutely do so. Our public sector aged care vaccination rates are very high, in the high 80s, but I want it to be at the highest possible rate. That'll be close to 100%. There'll be a few medical exemptions, but beyond that, everyone else should be vaccinated.
Sounds like we've got a tough stretch ahead of us in terms of cases going up. Probably our most significant one since maybe perhaps last year. I would think most Victorians will remember the point in the second wave where contact tracing fell off and became kind of ineffectual. We were completely overwhelmed. Can you give us an update? How many contact tracers do we have now, and at what point will they fall behind? Essentially, how useful are our contact tracers for the coming surge that we're
Around 2,500 staff working on all of those aspects, from contact tracing to the data entry, the epidemiological analysis, the occupational health physicians. There are so many roles. Contact tracing is supported by a huge and diverse workforce, but they are in their hundreds, indeed in the thousands. Contact tracing is most effective when you've got very low case numbers. When you've got hundreds of cases, it still does a really significant role. You identify people, you find their close contacts, they quarantine, you reduce the opportunities for the virus to spread. But we should never underestimate the role that each and every community member has in not going out unnecessarily, in not breaking the rules and seeing people, because contact tracing can only work with the cases that are identified to us. And those mystery cases that we're still seeing in significant numbers are those that get diagnosed too late, that have already been out when they're infectious. Now, contact tracing can't do anything for someone who's not been diagnosed, not gone to get that test. So it'll do a significant job, but it won't do everything.
Last question. Just to check, the Premier's theory last week was that these numbers, despite this lockdown and where we think we'd be suppressing it, these numbers keep going up or staying up for two reasons. He said that people are waiting too long to get tested with symptoms, and that people are breaching the rules. Are you in agreement on that? That's how the numbers are still up close to 200?
Yeah, pretty much. I would emphasise again what the BurnNet modelling told me, and what I've tried to convey, that at the beginning of September it would have been close to 2,000 cases a day, and every day thereafter would have been a third above that. You know, we're talking about tens to hundreds of thousands of cases avoided with the kind of vaccination levels that we've unfortunately still got at this point in time. Hundreds of thousands of cases would have been our reality. The fact that we're dealing with close to 200 a day is challenging enough, but it is the Delta variant in the face of 35% fully vaxxed eligible population.
But they're the two main contributing reasons to why it's happening.
Absolutely, yeah. in this level of vaccination coverage currently.
One last one, sorry. A few weeks ago when the vaccine hubs opened up to 16 to 39-year-olds, the Premier said at that time, keep your AstraZeneca bookings, because if you're in the age group, even if you book for an AstraZeneca, you'll be offered a Pfizer as well. Is that still the case?
No, it's not.
Okay.
No, that was early on. Now it's a case of booking for one or the other at your choosing, but that'll be locked in for you. Thanks all.
Thank you very much.
Thank you.
And at 1:45, I'll be doing the occupancy process. So do you want me to
It's pretty even across them as well.